If you have not accessed the CDC or the NACCHO websites for some of these tools, please make sure to do that, because they can absolutely help keep you from reinventing the wheel as you're going through this process. So this is one that we have used time and time again, the pyramid from Dr. Frieden and from the CDC. The reason that this is so important to this presentation, we use it often in other settings, but for this group, it is critical because it helped keep our steering teams and our work groups focused on the things that we needed to stay focused on. You'll recall, if you haven't seen this before, that this pyramid talks about some of the different choices and the population versus the individual health impact. As we were working through our steering team and our MAP process, we wanted to make sure that we focused on policy, systems, and environment when we were setting up priorities. Many of our partners come to the table, and I'm sure you experience this, at varying levels of awareness about policy, systems, and environment. Many of our partners are front-line providers, health providers. Some of them are community leaders that work with policy, maybe not health policy. And so this document or this chart helped us keep those steering team members focused so that we were all on the same page. And so I encourage you to use this as well. You do need a structured process when you're going out and working with your coalitions. How many of you, just make sure we're on the same, how many of you are currently working with various coalitions and members in your community now? Okay, so almost everybody. So you know that people come to the table with different agendas, different filters, different points of reference, and to work together to come up with a community health improvement plan. One of the best things you can do is to help get people centered on the same place, and this document will help you do that. Next. This is another chart that we have used. We lovingly refer to it as our egg diagram. And so what our premise here is that every agency in the community has a role in the public's health, in improving the health status of that community. It is not just the local community hospital. It is not just the public health department. Every agency in this community has a role in the public's health. And so we used this chart to strategically populate our steering team. You may know that when you start to work with a coalition, often you tend to populate it with people you know and like and have worked with and can depend on, correct? And that's fine. That's a great place to start. But we took the premise that not only do you want to have people where you have some history with them and can count on their work and their involvement, but you also need to be strategic about the people that you bring to the table. So this chart helped us to pull people from local government, from our large school system, which serves about 100,000 students, from local cities, from hospitals, from private providers, all the folks in the community that might have an interest and a say in the community's health. So I encourage you to also use this egg diagram as you are creating your steering teams and your implementation teams so that you make sure not to forget anybody, because everyone has a key role. The second thing that I would encourage you to do is to make sure that you develop a business plan or a strategy well in advance of going after the funding or picking initiatives or projects. Because again, I would hazard that everybody in this room who has worked with coalitions knows that when you're sitting around the table, that whoever's voice is the loudest or who has the money in their pocket to invest is sometimes where the group gravitates to in order to make a decision about what they're going to get behind. We strongly encourage you to develop a business plan with all those people at the table, reviewing that business plan well before you start to launch initiatives. So you have your data that you've used that Emily referred to of your health assessment, and then as you do your health improvement plan, you establish what are your strategies, what's your plan, so that then moving forward, if at any time you start to waver toward the money, or towards the loudest voice, you can then come back to that business plan and get grounded again. It takes time. It's a tedious process, especially when you're talking about 30 people on a steering team, but it will pay off in the end, I guarantee it. Now I want to show you a video that we used when we kicked off our community launch. Back in 2012, we had several of our partners participate in creating this video, and we thought it would speak for itself.
The number of Georgians affected by health-related issues such as diabetes, hypertension, and obesity continues to grow every year. Among our nation's youth, the numbers have reached epidemic proportions. Nearly 40% of our children are considered to be overweight or obese. We need a plan to reverse this downward trend and improve the health of our state. Since my inauguration, I've made it a priority to encourage healthy living among Georgians so that they can experience life at its fullest potential. I am committed to implementing initiatives that advocate active and smart lifestyle choices among Georgia's youth. By promoting these strategies early, we can foster children to become role models for healthy living in their families and communities. Eventually, this trend will echo statewide. Your strategic initiative will endorse positive changes toward wellness. I am excited to support this initiative, and I look forward to seeing a healthier Cobb County.
I've been gardening basically all of my life. I grew up on a farm in East Central Georgia. It's my passion. It's good exercise, it's reduced stress, and I get to eat healthy foods and teach others and to share the vegetables with everybody else. They're low cost, especially when you grow your own, and thereby making them affordable, and then you can share them with other folks in growing vegetables. And we'd like to ask you to come forth and join us in this movement to eat healthy food, grow your own vegetables, who's available through local markets, churches, schools. Our commitment is to ask you to grow your own or to eat 5 vegetables or fruits each day. And it's time to start now.
The health of our employees is vital to Lockheed Martin, not only because we care about our people as individuals, but also because a healthy workforce is a more productive workforce. In recent years, our focus has shifted more to prevention. We brought our program to a new level by offering more wellness incentives and by educating our employees on ways to maintain an active lifestyle, both at work and at home. With the help of our on-site wellness centers, our employees are provided an expanded list of services such as preventive care, nutritional tips, and health education. These tools allow our employees to be more proactive in managing their health and in reaching their personal health goals. Regardless of the size of your business, you can promote health prevention and wellness activities at relatively little cost. It's the right thing to do for your employees and for your bottom line. I challenge you to join the Cobb 2020 initiative. Fill out your pledge card and invest in wellness today. I look forward to sharing ideas on how all Cobb residents can live healthier, happier, and more productive lives. We must start now.
At WellStar, we believe in delivering world-class health care. In order to do that, we need our 12,000 team members making a personal commitment every day to the services that they provide throughout our hospitals, our emergency departments, and our physician offices. As a healthcare provider, we know that a few simple things can make a difference in your health status. Eating properly, eating the right amount of food, not smoking, and moderate exercise of 30 to 40 minutes a day will go a long way in controlling your risk for chronic diseases. I'm asking you today to join with me in the Cobb 2020 partnership. At WellStar, we believe in a life well lived, and through your commitment, we can help prevent chronic illnesses in our community. Thank you.
Today's lifestyles are filled with sedentary activities. We spend too much time in front of TVs and computers, mindlessly eating junk food, working too much, getting no exercise, and too little sleep. These habits are resulting in dangerous health issues, including obesity, heart disease, and diabetes. It's time to take control of our lives, physically and mentally, and get on the path to better fitness and well-being. Fit City Kennesaw is a citywide initiative to encourage residents to embrace a healthier lifestyle. It focuses on promoting nutrition and exercise with a goal to reduce obesity, combat inactivity, and thus improve the quality of life for everyone. Take action now to design active community spaces, encourage business involvement, and promote health through sponsorship of healthy citywide events. Make your community safe and healthy. Get involved in today. Start now.
We need to declare war on our obesity epidemic. It is ravaging the health of our families and driving our healthcare costs out of sight. I've made a personal commitment to exercise and healthy eating, and so can you. Just begin one step at a time by committing to more physical activity and healthier eating at home and at work. Please join our Cobb 2020 partnership. Help us make the healthy choice the easy choice.
So this video has been used frequently. It's on our website, and we have used it for many presentations. And I hope that you see that it has involved many of our key leaders in the community. They didn't just make this video. They have been on board with us the entire time and have been making very personal and regional decisions related to health and wellness as a result of their involvement. Go ahead. I won't go over a lot of successes. We've had many, as well as the challenges over the past few years. I would invite you, for more information, to visit our Cobb 2020 website and also to attend some other sessions that we're hosting here at the NACCHO conference. These are just a few. We have seen better partnerships. I would tell you, having been in Cobb County, that I had many partnerships with folks in our community. But the Cobb 2020, the Cobb MAP process, the Community Health Improvement Plan has strengthened those partnerships, has taken them to a new level. And the biggest benefit is that we are all pulling in the same direction. And I think that's been the key for me, is to be able to see us all working in the same direction toward the same goal, instead of being somewhat disjointed, still focused on health, but disjointed on the targets that we might want to hit. Go ahead. You might have seen the $2 million. Let me just say we'll answer that a little bit later. We are excited that we've been able to bring more funds into the community. Some of those were related to our health assessment and our health improvement plan, but they've also helped fund some of our pilots that we've recently launched. So we can share some of those resources with you as well, where we got those. These are just some of the pilots and campaigns that we have launched over the last few months. Most of them are in a pilot stage. For example, the YMCA and the Summer Fit, I invite you to a presentation tomorrow afternoon. We'll be covering more information about this with Becky Shipley from the YMCA and Mark Anderson from Cobb County Schools. All of these others, we're happy to answer some questions if you have particular information, but truly we could go on for about a whole day on all of these to review with you the pluses and minuses of them. Okay? So I want to turn a little bit to not just the general partnerships, but our partnership with our local community hospital. This has been in the making for about 4 decades in Cobb County. We have had a variety of levels of interaction and partnership over the time that public health and the WellStar health system has been in Cobb County. And I will tell you from a steering team perspective that what you want to do is to start wherever you are and then to move the bar up. Start where you can with your local hospital, whether that's through your infectious disease areas or through health assessments, and then build from there.